Have you ever had pain at the top of your foot? Maybe you have a large bump that could be either in the midfoot or at the top of your big toe, or numbness, burning, and tingling. Or is it during when you walk, the top of your foot's compressed? I'm going to get to all these things. So let's get going. The most common source of top of the foot pain is a large bump right here or compression at the top of your shoe. So this could be either your shoes are too tight or you're developing an actual bone spur. This is called your mid-tarsal joints, and what happens is as you walk, basically your big toe jams up into your midfoot and can cause arthritis over years. And then this bump under here compresses the nerves that run along the top of your foot to your toes, and you're going to get swelling, numbness, burning, and tingling throughout your foot. So that's probably the most common thing. And I'm going to get to the treatment, so keep watching, but just listen if any of those other things apply to you. You can have osteoarthritis in your big toe as well. Big toe arthritis leads to pain, and you're going to have bumps on top of your foot like this. These can do the exact same thing. This hard spurring on the top, it can compress your nerves. Even in the midfoot or towards your toes more, can cause numbness, burning, and tingling. So that's another common problem that could be taking place in the top of your foot. You could have a ganglion. What this is, in your foot joints, if you have a soft tissue that you can kind of move around, it could be an outpocketing of the joint fluid. What happens is the joint capsule can rupture and you have a balloon that forms. But this is very easily treatable. You can just poke it with a needle, and about 60% of the time it doesn't come back, or you may need more extensive treatments by your podiatrist. And the next most common thing is pain and swelling from a foot sprain. If you ever watch NFL football, this is very commonly known as the Liz Frank sprain, because your mid-tarsal joints are your Liz Frank. So if you have a big swollen midfoot with bruising, this could lead to long-term dorsal bone spur formation, as I showed earlier, and other problems. So you definitely want to get seen by a podiatrist to get this checked out. So if you have one of these, it most likely happened due to abnormal forces during walking. Your big toe is a little bit stiff, or you're wearing the improper shoes, and over decades your column compressed and bones formation happened at the top. And this happens due to abnormal phases of gait. So for some people, if they don't stretch enough, their calves are tight, their plantar fascia at the bottom of their foot are tight, they spend more time in toe off rather than heel strike than they should. So here's how you take care of this thing at home. First thing you need to do is decrease the inflammation. So take some anti-inflammatories with the care of your podiatrist in case you have some bad reactions like stomach problems, and freeze some ice and put it on top of your foot. You want that inflammation to go down initially, decrease that pain. You can massage the top of your foot, or if it's in your arch, massage the arch of your foot, the midfoot pain. And the most important thing you can do as your inflammation's decreasing, get a pair of over-the-counter inserts. I recommend something like a Power Steps. There's a lot of cheap imitators out there that don't work at convenience stores, but for 20 to 30 bucks or so, you could get a great pair that's going to change your life. So as your inflammation decreases, it should take a couple weeks for your nerve pain to go away as you're icing and taking anti-inflammatories, and then keep it away longer with over-the-counter inserts. And in 50 to 60% of the people, as long as they don't have that bone formation on top, the pain is dramatically decreased and shouldn't bother them too much. But if it's still bothering you, look into some good shoes. And on DetroitFootPain.com, we have a good shoe guide. Get some custom inserts made at your podiatrist. Get some physiotherapy done. And as I mentioned earlier, stretching. Stretch out your hamstrings, your calves, the tissue at the bottom of your foot. Improve your foot biomechanics. And then the last percent of people, if you do really have a bump that's sharp, causing you severe problems or foot instability, you may need to see your podiatrist and consider surgical options because bone won't go away by itself. So if you had that bone on the big toe or in the middle of the foot, you may need surgery. And you probably already know this, that's why I'm saving it for last, but always just consider weight loss.
Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.